So please can you introduce yourself for the audience?
My name is Dr. S Singh. I'm a cardiologist from the USA.
And how long have you been living at the Tikri border?
So we've been here, so as far as our team, we've been working from day one. I arrived here first week of December.
Okay. And you were in the camps when the second wave hit. So what kind of corona patients or corona surges did you see at the camp?
So we didn't. We actually did testing. We gave out over 1 million surgical masks. We have given out over 100,000 N95s. We have gone place to place to help and teach people about COVID and Corona. We actually went out to Delhi. We have treated patients in Haryana, Punjab. We gave out oxygen all the way in Punjab to hospitals there who needed oxygen at the time, oxygen concentrators. So we have done our part. Now we're doing the vaccine. So we're trying to make sure that there's not a third wave in the coming years.
No, but then my question was still, what did you experience in the camps?
So there was no COVID in the camps.
There was no COVID in the camps?
In the camps, and we did testing, and we monitored.
You mean to say there were not even one single patient?
There was not even a single case of COVID in the camp.
In the Tikri camp.
And I can tell you why. Because if we had cases there, I would have never been able to go out and help people in Haryana, Delhi. And if you go back and you see my videos, how we worked every night to provide concentrators, and we went home to home to provide care, we would have never been able to do that because I'm the lone doctor at Tikri. So if I was not there, then who would be treating those patients there, right? So it's just that it's not it's an answer that you just have to use your sense that this doctor is going out treating patients outside for COVID, then probably there's no COVID in the camps, and that's the way it was.
And why would you think that is happening?
So a lot of things. Herd immunity is probably part of that. Immunity, overall strong immunity of these people. Second, another thing is we're all crowded into a small space, and it's the same people. So there's the interactions between the outside world and the inside. Maybe that has something to do with it. People did start to get vaccinated. That probably had a little bit of a part to play. So there was a lot of things, and then I think we played our part, trying to teach people, trying to do whatever we could at that time. So I would just say we were greatly successful, because if you look at the pictures from Delhi, Haryana, and compared to what happened in Andolan, I think we were hugely successful.
See, I've also spent weeks at the Tikri border, and in no way can you contain that area, because it's open and porous. There are thousands of police people entering it, journalists, people going in and out.
So I don't know if you saw the houses that we built. So we built
towards the stage, right? Like you guys are placed right.
About 2 kilometers from the stage, the wire has been there.
Yeah.
The facility, you guys were one of the first ones to do a story on that.
I've seen your complex actually.
And that was from the wire. And so we have established that place. We have built over 1,250 homes for people. So taking people out of the trolleys into homes was the big reason, was to try to control COVID, make sure it didn't happen, because we gave them a space to live where they could actually stay a little bit further apart. So like I said, we have done a lot. I can give you a whole list of things that we did that the government could have done but didn't do. That's why we were successful.